So yeah, Dr. Vineeth,
Yes,
tell
sir.
us something about yourself.
Sure, sir. So myself, VINEETH LOHIDAKSHAN. I'm a medical graduate. Sir, I hail from Ernakulam district of Kerala. I did my schooling in my hometown and I did my graduation in medical science from Government Kilpauk Medical College in Chennai. So my optional is anthropology, and I consider myself to be an optimistic person who firmly believes in hard work and perseverance, sir.
Good. Good to know about you. And tell us something about the place where you come from, Dr. Vineeth.
Yes, sir. Sir, so basically, I belong to Ernakulam district, which is known to be the commercial capital of Kerala. And my place in particular is called 𝙁𝙤𝙪𝙧𝙨𝙚, sir. So it is an eco village in itself, which is in like very much harmony with nature. We have a bolstering tourism industry, which is in collaboration with, we have an elephant corral wherein we bring in young elephants, train them, and then once they are mature, we ship them back to other places. And we also have very rich religious place of Malayatur, which is the International Christian Shrine Center in a nearby location itself. So this is regarding our place, sir.
Good, good. Yeah, you're a doctor.
Yes, sir.
So why did you choose to become a civil servant?
Yes, sir. Sir, it was the various opportunities that I got in my medical career. I had the opportunity to work in both COVID second and third wave of the ground level. And so during that time, I had an opportunity to work with COVID control center of the Chennai Corporation. Then I had come up with the aspects of administration, which made me an interest towards administrative part. This made me to shift towards civil services, sir.
Mm-hmm. Okay, okay. Any reason other than this?
Yes, in particular, another reason the exposure during 2018 Kerala floods, sir. So the works of each and every district collector, so the 14 districts in Kerala, was one of the most notable ones, which was like widely acclaimed. So I understood that there is like very much potential associated with this field as such, with diverse opportunities and challenges, which I think made me the first initial trigger for me, which was consolidated during the COVID times. Sir.
Good, good. So, Dr. Vineeth, what according to you are the most important qualities a leader should have? You can just mention 3 most important qualities.
Sir, as such a leader, as such as one is as decision-making skills. Sir. At times of crisis, leader should be one who can take up decisions for the entire people. Sir, another is the aspect of unification of the team. He should be able to get the team all together at moments of crisis and have the confidence of team members. And the third one is the confidence of the leader itself. So he has to be confident in each and every decision he takes to make it implemented as such. Sir. These are 3 qualities which I consider. Sir.
Mm-hmm. So what according to you are some qualities a new generation leader should have?
Yes. So with regard to a new generation leader, I think the challenges that is being presented by new generation are diverse. So this challenge management of the modern times is something I think a leader should be having. And another aspect is with regard to technology, sir, because we are having a greater aspect of technology. So this can be brought in to various aspects to help within himself for leadership qualities. So this aspect should also be within probably leader. And sir, third aspect, sorry, sir, I'm currently unable to get one.
It's okay.
If I can,
Not
can I think on for? Thank you.
Yeah, please. You take some time and try to recall and get back to me.
Sure, sir, sure. Sir, third aspect, which I feel with modern times is one of the mental health care in itself, because we have a very much priority mental health. So, I mean, leader in modern times, I think he has to come up with the mental challenges. He has to overcome the mental challenges also in the modern era. So.
Okay. So, Dr. Vineeth, tell me
yes,
3 major problems faced by your district according to you, and suggest me 2 solutions for each of them.
Yes, sir. Sir, basically, so with regard to Ernakulam, one of the most problem that I have experienced is also is regarding the traffic congestion which is present. So the city is as such very much congested due to the traffic. And the second problem that I feel is with regard to the waste management of the city, sir. And it was in news recently with regard to the Brahmapuram waste plant, which had problem related to the waste burning, which was continuously for 2 weeks, which was uncontrolled, creating pollution in the city. And the third part is regarding the accommodative policy for migrant laborers, because Ernakulam is a place with high number of migrant laborers. So we have to have accommodative stance for accommodating these migrant population to ensure quality life for them. And sir, for solutions of each of these problems, sir, one with regard to the traffic congestion as a multi-modal network that we can come up with. One is regarding the metro and the water metro, which we have come up with in collab with the electricity buses. So these kind of public transport method can be one solution. So another aspect is perception change to adapt to these public transport mechanism. This is two for traffic congestion. And with regard to waste management, sir, one I feel is necessary is the source segregation, which is particularly absent in a very limited scale that is happening now. And the second aspect is we have a very good Kudumbashree model, SHC model, which can be utilized for waste collection, which is another aspect which is pending. So this can be combined with the latest technologies of waste to energy conversions, so that we have betterment and power aspects also. And sir, with regarding migrant population, I think first aspect has to be in the state level, so that we can have a policy level at the state, which can be emulated by the local governments for their accommodation. And sir, third aspect is the second solution for that is proper identification and registration of these migrant workers, because there has been incidents of rising crime rates also. So proper identification and registration can help to control these and accommodate them well. So.
Okay, good, very good. Dr. Vineeth, why are many doctors leaving their career or as medical professionals?
Sir, here I would like to respectfully differ from that opinion, sir, because from my aspect, most of the doctors are continuing in the medical field, especially with regard to my own aspect. My college had 250 doctors in from each batch, and out of that, only me, I have shifted towards civil service. And other than that, 249 students are pursuing their career in medical science itself. But sir, if some are shifting in that, maybe some people, students are going abroad for their studies, especially with regard to streams like USMLE exams and lab exams. This, I feel, sir, has been due to the much more focus on research-oriented education, medical education that is present. So students, this aspect is happening, sir. But I don't think there is much shift towards other sectors.
Okay, okay. Kerala, we all know, is a success story when it comes to healthcare setup. But still, I know you worked in you are associated with Tamil Nadu, but still, have you got to know any issues in the primary healthcare setup of Kerala? Could it be improved better? Could it be improved further?
Yes, sir. Kerala health model is one of the very successful models, as has been indicated by various health indices like maternal mortality and other factors. Sir, I think one of the major factors responsible for this is primary care. One concern that I feel is that is there extra penetration of private sector. We have a good PPP model in Kerala, but this has contributed to the high out-of-pocket expenditure in Kerala in itself, because almost 65% of the expenses incurring are out-of-pocket expenditure. So I think this aspect is something I feel we have to address with. And another factor is that sir, there is good equity being present. There are few pockets, especially tribal pockets, that are still lagging behind. So the most notable example is the case of Attapadi tribal block, which had the infant mortality rates very high, which was comparable with that of Saharan countries during 2013. Though it has improved, but it has not been up to the mark. So I think these this is another sector we have to improve upon, sir. And another aspect is a normal case of infrastructure also has to be improved. We are doing good, we are in the right direction, but it can be further improved at integrating the technology, sir.
I got you. Dr. Vineeth, what can we do to prevent exploitation of the patients, especially by these corporate hospitals?
I feel one of the major exploitations come with regard to the diagnostics that is associated. So this leads to majorly the diagnostic leads to the out-of-pocket expenditure that is associated, and also the medications and the surgical cost that is associated. So the one major solution I feel is universal health coverage through insurance, sir. We are as our policy of 𝙁𝙤𝙪𝙧𝙨𝙚 is a right step. So providing this insurance part, this can help to address the one kind of exploitation. Sir, another aspect is with regard to the antibiotic resistance that is happening currently, because as per the studies, almost 94% of patients are prescribed antibiotics without the relevant diagnostic backup. So this aspect also leads to further resistance among the patients, which can affect their life when they further concur with any of the infections. So this also has to be rationalized, sir. And also with regard to the pricing of especially the branded drugs. So we can come up with generic drugs as we have been doing through Jan Aushadhi centers. So these are some of the ways I feel, sir, we can reduce the exploitation.
Okay. Are you aware of Clinical Establishments Act?
Sorry, sir, I will have to look up on that one.
It's okay, not an issue. Dr. Vineeth, in your opinion, did India handle the COVID-19 crisis effectively?
Yes, sir. So being a frontline warrior myself during the first, second and third waves, so I feel we have done very well with regard to our capacity of handling. Especially if we just have a look around through the journey of three pandemics. Our first wave, even when very high health infrastructure nations like Western nations fumbled upon, we were able to lead the way through. We had reduced mortality rate. We contained it really well with national lockdown and all the strategies. So during the second and third wave, the major criticism that has been raised is due to the high mortality rates. But sir, I would point out rather than looking at from a mortality rate, I think we should look upon the number of lives we have saved that could have been otherwise handled, like would have gone up into mortality. And also, despite having infrastructural bottlenecks, we came about quickly. We challenged back immediately with the available facilities that are present. So then we did it really well with regarding both the governance mechanism. We came with the PM CARES fund when we had fund shortage, which was channelized towards healthcare, and also with regard to our frontline warriors, including me. I have done my best during that time also. So I think we have handled it well, sir.
Okay. So Dr. Vineeth, what is this ABHA number? Have you heard of it?
Yes.
What it is?
Yes, sir. Yes. Sir, ABHA number refers to 𝙁𝙤𝙪𝙧𝙨𝙚 health number. So it is associated with a unique ID, that is alphanumeric ID, that is being provided to 𝙁𝙤𝙪𝙧𝙨𝙚 beneficiaries, so that this number would be associated with all their treatment and surgical records that has been they have underwent, and it also helps in streamlining of insurance policies via Atmanirbhar Bharat to them. So this is a unique ID related to ABHA number, sir.
Okay. Why should we maintain health records? Is it really important that to maintaining digital health records?
Yes, sir. Sir, I think the entire system of medical field lies in the aspect of health records, because clinical history of a patient is very much relevant to ensure effective kind of treatment to the patient by doctors. This is in terms of the surgical history. If that patient has undergone any surgeries, this is relevant for further back again follow-ups. And also the major problem as we are addressing now is again the antimicrobial resistance. So this also calls in for clinical records, and also the uh, proofing that the proof that has been manipulated, the fraudulent cases can also be prevented by proper health records, sir. So these are some of the advantages that is being provided by digital health records. And one is the easy, they can reduce the waiting time of patients in government hospital, especially because quick retrieval of data is possible for doctors in terms of digital health records. So these are some of the benefits I feel.
Okay. So what, according to you, are three biggest mental health issues right now in India?
Sir, so first one, I would say would be the depression cause that is associated, sir, because one of the most youngsters as well as young age people, along with the geriatric population, has been facing with depression problems. Sir, another problem which I would rate to be the bipolar disorders that is associated, because due to the increased stress pressure, work stress that is associated, people are going into bipolar disorders. In also it associated with schizophrenia. So that is mainly attributed to the work culture that is present. And these are the problems that I feel to be concerning the mental health of people. So, in terms of medical language.
Okay, I got your point. So, do you think after internet penetration, Dr. VINEETH, exaggerated reporting of mental health issues has become a new norm, isn't it?
Sir, I would like to put it in aspect that we are getting the right that stigma associated with mental health has been doing away with the penetration of internet, because there is more awareness about mental health among people. People are coming forward with their issues, and also they have platforms to arise their issues, to get it settled, to get mental support. So these avenues are being provided by internet penetration, and as it has been noted by the Telemanas initiative of government. It was like within just 6 months of its launch, it crossed 50,000 consultations. So that implies how much acceptance it is getting among people, and the lot of mental health problems within population. So I think internet penetration has actually aided in handling the mental health issue as such. So.
Okay. But how to control all these self-proclaimed mental health specialists that are creating a lot of cacophony on social media platforms? I'm sure you must have noticed this, Dr. VINEETH.
Yes, sir. It is one of the very valid points that we are having self-proclaimed claims that which we can relate to somewhat relate to a medical quacks. So it is just as a recognition of mental health problem is important. It is also important that we must get the treatment or support from qualified people in mental health care. So this aspect, I think we should have to counter with proper provision of both psychiatrists as well as psychologists being adapted to be the part of primary healthcare in itself. So one aspect of Telemanas is gaining initiative. So also we can integrate with eSanjeevani OPD of telemedicine. And another aspect is offline care can be provided through our primary health centers, I think, which was stipulated by the Mental Health Care Act also. But the implementation has to be stepped up so that we can make it to the last mile rural people, sir.
Okay. Any other ways you can regulate them?
I think one other aspect is generation of awareness regarding the problem of medical quacks, like the self-proclaimed people. So just make people assure them of qualified professionals. Maybe we can come up with exclusive medical e-medical platform. Other than the telemedical support, we can come up with certified medical professionals who mental health care professionals, both psychiatrists and psychologists, in a government platform so that people can take help from that platform. I think this is another aspect which I feel to regulate, sir.
I got you. Do you see any synergy between allopathy and Ayurvedic systems, or for that matter, yeah? So what are they? What are the synergies you can identify?
Sir, regarding the bridging part of both Ayurveda as well as the medical part, I think somewhere we can make it synergetic as with regard to the primary health care, sir, because we are having a shortfall of doctors, especially with regard to the doctor to patient ratio. So I think the primary healthcare provision can be integrated between modern medicine and uh, traditional medicine. And also another aspect I feel is that we can better our institutional delivery mechanism by giving training in um, the institutional delivery for traditional medicine practitioners. So these two fields, I feel there can be synergy between both the fields. And somewhere I think the controversy comes in as regarding the surgical field. So in my opinion also, we shouldn't be bridging up in the surgical field, sir, because modern medicine surgical doctors are coming up after years of surgical hands-on experience, which cannot be attained by few months of bridge course or any other training. So I think it is better to delineate between surgical branches and traditional medicine and bring in synergy where in areas wherein we can potential areas exist, and we can utilize this in other fields like medical tourism also, sir.
Mm-hmm. Okay. Dr. Vineeth, is there any correlation between human thoughts and disease?
Sir, in my opinion, human thoughts do affect our metabolic functioning of our human body as such. So one aspect wherein human thought affects is definitely the mental health. So our thoughts, our overthinking aspects, this can make us mentally unstable for reasons. Sir, another aspect, though it's not, I don't much know into the evidence base, but what I have felt is that always an optimism helps in better cure of the patients as such. From my experience in clinical aspect also, the better we provide mental support to the patients, the better optimism we provide, I have seen better cure for the patients. So this is what I relate between thoughts and.
What about your opinion? Does allopathy believe that there is a correlation between human thoughts and disease?
Sir, in my opinion, allopathy doesn't believe in thoughts and uh, the causation of diseases. But I'm not much into it. I don't know much evidence to support this one. Sir.
Is there any other field of medicinal systems which believe that there is correlation between thoughts and disease?
Sir, I am not fully sure in this question, so I think I'll have to look it up.
No problem, not an issue. Have you heard of this idea, Dr. Vineeth? Medicalization of social pathologies?
Sorry, sir, I'll have to look this up.
Not an issue, not an issue. If I say traditional Indian diet has more therapeutic value than most of the medicines we consume. Take your own Kerala diet.
Yes, sir.
Do you agree with me if I say this?
So can I have that question once again? Traditional diet?
Traditional Indian diet has more therapeutic value than most of the medicines we consume.
Yes, sir. Sir, I think I do second that opinion, sir, because our more, traditional diet practices has been mostly based on natural diet based, which has not been. One aspect is that it has not been contaminated by many of the uh, pesticides and fertilizers that are present as of today. And also, we had a diverse, locally sourced diets, and we had very much good source of millets during those times. So these were very much healthy, nutritious choices, which are in the contemporary society very much not much present in our diets. And also, we have much more into non-veg based, fast food based diet, and whereas it was not the case with the traditional diets. So these aspects I feel have provided the necessary health benefits. Also the work culture. We were much more into the primary sector in traditional times, which required hard labor and physical activity.
Okay.
So this,
Take Kerala Sadhya and tell me,
yes, sir.
because Kerala is often said Kerala diet. It is said as a manifestation of living. It's a living pharmacy. In the
Yes,
backyard of every Kerala home, there are many things are grown. That itself has a lot of therapeutic value. So take
yes,
your
sir.
Sadhya as an example and tell me all the nutrition and therapeutic aspects of it.
Can I take a moment on this question?
Sure, please.
Sir, with regard to the values with nutritious values with regard to Kerala Sadhya, one dish that I would like to particularly mention is the avial, which translates to be the Kerala version of modern day salad. It is what we say is that we can put in any vegetable in avial. So it is a very high rich source of every source. It is comprising of carbohydrate. The fat is relatively less, but both proteins and carbohydrates, it's a very rich source. And sir, another aspect is with regard to the what we say is the ginger curry, what we call the inji in the traditional dish. So this is a very highly good antioxidant dish in itself, which help to purify our blood, as it is being said. Sir, and another aspect is with regard to the uh, spinach uh, dish that is being present. So spinach is also a very leafy vegetable, which provides us with good fiber in itself, which is very good for gut health. So then these are some of the three things I feel are much contributory to our health nutritional aspect from Kerala Sadhya. Sir.
Okay. Okay. So what, according to you, is the toughest thing about UPSC examination, Doctor?
I think keeping ourselves motivated during the entire time span of like exam is diverse stages and it is prolonged. So I think keeping up that struggle, that motivation to throughout this journey is something I feel is the most difficult part. If we are able to keep up that, I think we can do good. Maybe not in exam, we can do ourselves good to our body and mind. Sir.
Mm-hmm. Interesting. Tell me some qualities you have observed from successful people in life.
So one of the most foremost qualities is never giving up attitude. So that perseverance is one factor which I have seen from most people, be it Abraham Lincoln or APJ Abdul Kalam sir. So they have never let down by failures. Sir, so this optimism, I will correlate with the optimism also, sir, that which is very much required for civil service also, since it's a very much unpredictable journey. Sir, another aspect is that belief in themselves. Self-belief is another factor because there are times like other people won't believe in us or our strategies. So we have to believe in ourselves and we have to execute it. And another is the confidence that is present. So all these aspects I think are common among most of the successful people.
Okay, good, good. If you are selected
Yes,
by UPSC, how do you ensure
yes.
that you would remain ethical, Dr. Vineeth?
So basically, my working would be first. I would be like I would like if I am posted in a particular service or any department. So first thing would be to analyze the situation or the challenges that are present or the concerns that are present within that sector. Sir. So I would like to map it out first and just remain just always remember the route I have come from. So with that aspect, I would like to address all these challenges, keeping away the fame or other achievements that can come on the way. So I think this thinking can help me to remain grounded, and especially my one aspect I feel is that my experience in clinical medicine, especially with COVID waves, especially second wave, I saw a lot of young age people who died during that wave. So that aspect, I understood that there is nothing much to be achieved, like in aspect. All we have is a life, and we have to do maximum good in that aspect. So I think that experience itself can keep me grounded along with these implementations.
Okay. You think spirituality is witnessing a decline? If you think so, what should we do to prevent that decline? Take example of your state and talk.
Yes. Sir, in my opinion, spirituality, I don't think as such it is reducing, but there has been effects of increased, especially we know science and technology is rising. So there are people who believe in objectivity and rationality are increasing in as such. So with regard to Kerala also, we know it is a scientific, I mean, it is a literate society. So that rationality among people is high, but especially with regard to the recent inauguration of our Ayodhya Ram temple and the emotions of people, I feel spirituality is not on the decline as such. That there is still people, and also if you look at the number of people visiting our major centers of, if it is like Tirupati temple or Shabarimala temple, because we saw a footfall of almost 1.5 lakh people per day in Shabarimala, which had a capacity of almost 75,000 only for a day. So it increases that, it shows that much more people are into spirituality, but also the aspect of rationality and people getting into the other aspect is also present. Sir. I don't think there is a rapid decline or a wholesome decline of spirituality.
Okay, I agree with you. So I'll just read out a statement for you, Dr. Vineeth. Try to interpret the statement.
Yes. Sure. Sir.
Two biggest sins of modern democracy are unfulfilled potential and avoidable suffering. We have plenty of both. Try to interpret this statement for me. I'll read it again, listen carefully. The two biggest sins of modern democracy are unfulfilled potential and avoidable suffering. We have plenty of both.
Sir, my interpretation of this one would be like unfulfilled potential. I would like to correlate with the vast human demographic dividend that we have in our society, sir. So we know we are like the most populous nation, and we have definitely for next 3 decades we have the largest youth base. And with regard to the unfulfilled, it was that aspect. I feel it is the aspect of welfare state that we are being associated with, because our Indian constitution wants our nation to be welfare state when we are capable of. So still we haven't been reaching to that level. So that aspect of maybe inclusion of marginalized sections, provision of better healthcare facilities, educational facilities. So these aspect is the one part I think that part denotes to, sir. So these are two areas I would like to map it to.
Okay. So you are done with your interview, Dr. Vineeth. Thank you.
Thank you, sir. Thank you so much.